If you want to move away from modern medicine, if you want to discover healthier alternatives for your family, if you want a healthy body, then you're in the right place. Hey beauty, I'm Alexandra. I'm an author and clinical research nurse who discovered that Jesus is the source of true healing. I am the Lord your healer. Exodus 15:26.
If you've been listening to my show for a while, you know that I am a nurse, but I have worked in the clinical research field for years, and I haven't really been working as a nurse in a long time. Well, for few years now, I've been really curious about hospice nursing, and a few weeks ago, I got a new job as a manager overseeing a home hospice care team. In the span of just less than a month, I've been shadowing some people in the field and I've met some amazing patients. Fun fact, before I was a nurse, when I was in high school, I used to work at a nursing home and I really, really loved seeing the nursing home residents. I just loved working with the geriatric population and listening to all the stories that the residents had to tell. Anyway, if you are familiar with hospice, patients can be put onto hospice care by their doctors if it is determined that they have 6 months to live or less than that. So obviously, the patients that I've been seeing have been really super sick. And of course, when I'm seeing these patients, I wonder what went on with them in the past. I wonder how they used to take care of their bodies. And I want to make it clear that what I'm about to say is not meant to make anyone feel guilty and it's not meant to condemn anyone or it's not even me saying that I know what's going on. It's me being curious and me encouraging you to perhaps see the healthcare system in a different light and to also just question how you've been viewing health in general. In my book, Discover God's Health Wisdom Exposing 8 Common Myths That Keep You Sick, one of the myths that I bring up is this: I can sit back and let the medical system take care of me. One of the patients that I saw, if you're super sensitive, I would advise you to perhaps turn this episode off and listen to a different episode. One of the patients that I saw, she was really super thin. She was basically just skin and bones. Her arms and legs were contracted. She couldn't move on her own. She had a urinary catheter and she had these really bad, we call them pressure ulcers on her back, on her buttocks, and her feet were basically just wasting away. So the LPN would go to the house and she would do these dressing changes on this woman. The patient also couldn't talk. She couldn't really verbalize how she was feeling. Before I entered the house, the social worker gave me a mask because she said, I don't know how sensitive your nose is, but this woman's wounds are so bad and it doesn't smell very good. So I'm just going to give you this mask if you need it. So her back and her buttocks, they were so raw. It's hard to describe unless you've seen something like that before. And I mean, no disrespect to the patient at all. And of course, I'm not telling you who the patient is. Her skin was so raw. It was kind of like going to the store and getting like a raw piece of steak or something. Her skin was so broken down that her tissue was exposed. And she had this pressure ulcer on her buttocks. So whenever she had a bowel movement, of course, the feces would get into this wound on her buttocks, and she had to be cleaned up in that area. It was just an extremely sad situation, and her daughter was her caregiver, but her daughter was also sick with a chronic illness. I also saw another patient who had three brain bleeds. His wife was looking after him. She was the caregiver. And when we saw him, he was extremely irritated. He was swearing at us. But when we went to the car later, both me and the nurse agreed that we felt like that wasn't his normal personality. It was almost as if he was acting like he had a traumatic brain injury. We had the assumption that the brain bleeds had, of course, affected his brain so much that it changed his personality. I didn't get to look at a full health history on him, but once again, both me and the nurse, after hearing some of his story, we had the assumption that the brain bleeds occurred because of treatment that he had been receiving due to his chronic illness. And the nurse was actually the one who said to me, at that point, it's like, is the treatment even worth it if because of the treatment, he's going to have these three brain bleeds and have this personality change? It was just another really tragic situation. They had this beautiful house, and I was looking at these awards that he won. It looks like he won an award for agriculture, and I think he was a veteran. Yes, he was definitely a veteran. And also, remember, I have only been working in hospice for less than a month, but I have also heard two stories of two different patients being raped in facilities. There's this gentleman with dementia who was raped in a facility, and then I believe it was an older gentleman again who was possibly raped twice in maybe two different facilities. I think these older gentlemen were raped by residents in the facilities. So, all this to say, once again, I don't know the complete history of these patients, but I just wonder if they had made different choices, health choices, if they had not said yes to some of the treatments that they had been offered, would it have looked different for them? I don't know the answer to that, but I've said on the show before, when I see patients like this, when I've seen patients like this in the past, this has been turned this has turned into the reason why I am so committed to taking good care of my body. I don't want to be dependent on a very flawed medical system. I want to give you three health reminders today. Hopefully, these health reminders will encourage you. Actually, before I get into that, I do have one cool story to tell you. There was this one lady that we visited. She had gone on into hospice and everyone thought that she was going to die. She was marked as imminent. They mark patients as imminent when they believe that the patient has 5 days or less to live. So this patient had been marked as imminent, but according to the nurse that I was following, she made a miraculous recovery and going to, she was thinking about going off of hospice care. So I wanted to end these stories with a more hopeful story. Here are three health reminders for you. Number one, remember to ask God for wisdom when it comes to health and when it comes to all areas of your life. This basically became the theme of my book, Discover God's Health Wisdom. I always tell the story of Joshua in the Bible, how he was deceived by the Gibeonites because he did not seek counsel from the Lord. You can read about this in Joshua 9, the Gibeonite deception. Unfortunately, in our culture, we've basically been taught not to question the doctor, not to question the quote experts, but to just go along with everything that they say. Some doctors are really smart, some doctors really care, but at the end of the day, they are just people. God knows what is best. He's the one who created our bodies. At the end of the day, maybe he does want to use a particular treatment or a particular doctor to help you, but then again, maybe he doesn't. Maybe what the doctor is prescribing to us, what the doctor is telling us to do, what whatever surgery the doctor wants to do is not the wisest choice for us. And unfortunately, sometimes when patients go into the hospital, sometimes they're not very sick, but what happens in the hospital, they get these infections, medical errors occur, which is one of the top reasons for death in this country, medical errors. The doctors and nurses are so tired. They're just told to follow certain protocols, and sometimes patients just get worse and worse from one hospitalization. So that's my first health reminder to you. Remember to ask God for wisdom when it comes to your health and your entire life. God wants to help us. Says in James that if anyone is lacking wisdom, he should ask God, who will give generously to all without finding fault. Health reminder two, remember that you reap what you sow. Galatians 6 talks about this concept, and it's not talking about it in the context of health. However, we live in a world of consequences, right? Our choices have consequences. But in the health world, I feel like for some people, especially in the the conventional medical industry, they don't necessarily believe in this concept, it seems. This leads me to another one of the health myths that I wrote about in my book, Discover God's Health Wisdom. The myth is my body is inherently dysfunctional and there's nothing anyone can do about it. Sometimes when we go to the doctor and they diagnose us with a chronic illness or something, they say, okay, the only way that you can get better is if you do this, if you take this for the rest of your life. They kind of treat our bodies like they're inherently broken and they will always be broken. Yes, we live in a fallen world, and because of that, our bodies are, they're not perfect. But the concept still remains we do reap what we sow. So if we start to eat better, if we start to exercise more, I'll go into more things that we can do later. All of these can make a huge difference for our health. This leads me to the last health reminder. Remember that simple, healthy habits lead to a healthier body. So these two health reminders go hand in hand. As I said before, it is a myth that this is the myth. My body is inherently dysfunctional and there's nothing anyone can do about it. The truth is that you can do a lot about your health, especially when you have God, the Almighty, the creator of all things. Truth is that prayer can change things. The truth is that faith can change things. The truth is that, according to Dr. Caroline, I think it's Carolyn Leaf, who studies the brain. I was watching this YouTube video, I think I mentioned this before, that she was talking about the thoughts that we have. The thoughts in our brain create these things, I don't know what to call them, these things in our brain that look like trees. You can see them on imaging. So imagine if you have a thought in your mind. That thought is something like, I don't know, I am ugly or something like that. Okay, you have a thought in your brain that comes up, I am ugly. You can see on imaging, if you keep repeating that thought in your brain, I am ugly, the tree in your brain grows bigger. But they've seen that if you stop that thought, that tree, that thought starts to die out in your brain. So think about this for a second. The brain basically is the command center of your body. So this is why I'm so into holistic health. Everything is connected to every little part of your body is connected to another part, right? So if you think about it, your thoughts, if you're growing negative thoughts in your brain, of course it's going to affect the rest of your body because your brain tells the rest of your body what to do, right? So even your thoughts will affect your stress level, or it will affect your body, will affect your inflammation. So going back to that myth that I was talking about before, the myth is my body is inherently dysfunctional and there's nothing anyone can do about it. That's a myth because you have so many tools at your disposal. You have the truth that you can input into your brain. Instead of the negative thoughts, you reject those negative thoughts, you replace them with the truth. So you, instead of thinking to yourself, there's nothing I can do to improve my health, you reject that thought and you replace it with the truth. I am a child of God. I can do all things through Him, through Christ who gives me strength. God is my protector. God is my healer. Those thoughts, that truth that you're putting into your brain will change your thoughts and ultimately change your health. Prayer will change things. Your faith will change things. Changing your diet will change things. Exercising, sleeping more, resting, lowering your stress level, being conscious of your breath, forgiving someone. It's these simple habits that we take for granted. These habits can make a huge difference for your health. So, as I said before, I don't know if these patients that I saw, I don't know what their health habits were like. I don't know necessarily what their belief systems are. I don't know if they could have had different outcomes, but I do want to encourage you with these three health reminders. I want to challenge you to remember to ask God for His wisdom when it comes to your health and your life in general. I want to remind you that you reap what you sow, and I mean that in an encouraging way. You do good things for your health and you will start to see a difference. Number three, remember that simple, healthy habits lead to a healthier body. I want to remind you of my free gift for you. Go to herholistichealing.com/free and enter your email to download Holistically Healthy Woman 4 Steps to Move Away from Modern Medicine for Christians.
Thanks for listening today. If you like what you heard, would you take a minute to leave the show a review? If you want to connect with me, you can join me in my free community. The link is in the show notes, or go to herholistichealing.com. Matthew 11. Come to me, all who labor and are heavy laden, and I will give you rest. Take my yoke upon you and learn from me, for I am gentle and lowly in heart, and you will find rest for your souls.
For you, it's easy and my burden is light.
This content is for informational purposes only and is not meant to be medical advice.